I'd like to call the meeting of the board to order. Will the secretary please call the roll? I see them. Can't hear them.
Hello.
Thank you. That was Director Bott, right?
Yep, present.
Thank you. Director Garza?
Present.
Thank you. Director Green? Present. Director Harrington?
Present.
Director Kim? Present. Vice Chair Lowry?
Present.
Director Ryder is absent. Director Robinson?
Present.
Director Sorrell is absent. Director Webster Cross? Present. And Chair Taylor?
Present.
You have a quorum.
Thank you. The next regular meeting of the board is scheduled to be held on Friday, January 31st at 9 a.m. However, it is likely that the meeting will be moved to be held a week earlier on Friday, January 24th at 9 a.m. As soon as that date change is confirmed, it will be communicated publicly. I'd also like to entertain a motion to allow Directors Bott and Garza to remotely participate in this meeting as voting members. So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? All in favor?
Aye.
All opposed? Thank you. The ayes have it. The motion carries. The first item on today's agenda is employee recognition, which will be reviewed by Dr. Makida.
Thank you, Chair Taylor. Good morning, directors.
Good morning. Good morning.
Start with our new hires. We welcome Joseph Kapanis, Director of Quality, Regulatory Affairs and Accreditation, Quality and Patient Safety. Omar Hafiz, Data Manager, Health Plan Clinical Services. Catherine Simonek, Nurse Coordinator 2, Burn ICU, and Ricky Hem, Clinical Operations Nurse Supervisor, Medical Surgical. And we had one promotion over the last month. Congratulations to Latanya Davney, Manager of Operations, Regional Outpatient Center at Blue Island. And there's actually one more recognition before we move to announcements. I just wanted to take a minute to recognize Dr. Claudia Fegan. Today's her last board meeting with us.
Dr. Fegan.
Dr. Fegan joined us 24 years ago, became Chief Medical Officer in 2013, and she's brought an unwavering commitment to healthcare reform, social justice, and the well-being of our patients. Her work has shaped the direction of our health system and has had a profound impact on the lives of countless individuals who rely on CCH for care and services. Her leadership and dedication to advancing the quality of care at Cook County Health have been truly remarkable. Her advocacy for equitable access to care has made an indelible mark on Cook County and also the national healthcare landscape. On behalf of the entire Cook County Health team, thank you for your years of exceptional leadership and service. We're deeply grateful for your contributions, and you will be greatly missed.
This is not an easy job. She has not had an easy job during easy times. And so I think, I'll speak on the board and directors. Please weigh in. Dr. Fegan, we appreciate all you do. I mean, this is, you've made significant impact positively on the lives of countless people in our community and the county. And so we are grateful and thankful, and whatever mountain you conquer next, we're sure it's going to be great. But we wish you the best.
Chair, if I could, I'd like to also say to Dr. Fegan, thank you for modeling Galatians each and every day as you have loved and served the community through the provision of health care. We really appreciate you. I'll also say, in a more selfish way, you're a valued resident of the 3rd District, so I truly appreciate you. And I want everyone to know that you in February at the meeting of the Board of Commissioners. So I would invite all who can join us in the chambers so that we all can salute your great service.
Well done.
Yeah, I'd like to commend Dr. Fegan not only for her managerial role, but more importantly for her patient care over the years. I'm sure she's developed a close relationship with all of her patients, and they will probably miss her more than we will.
Dr. Fegan, I would like to thank you not only for what you do for patients, but for the growth that you brought to the healers of patients. and for your demonstration of leadership and excellence throughout the years. Thank you.
Dr. Fagan, our time has been very limited, but, it's gonna be strange not seeing you, because I always see you because I sit here and you sit there. And most of all, maybe just outside of here, we can enjoy some water sports together, or snow skiing.
I believe Dr. Bott raised his hand.
Thank you, Mr. Chair. Dr. Fegan, just wanted to say that I appreciate your leadership and commitment to patients and the important issues of equity, and really embody what the county health system advocates and stands for and the mission. And so just grateful for all that you've contributed to the system and our community. Thank you.
Okay. All right, thank you. So moving on to recognitions, I think everyone's aware, but earlier this week, we announced that Providence achieved the recognition of Top General Hospital by the Leapfrog Group for 2024. Leapfrog is widely acknowledged as one of the most competitive honors for U.S. hospitals around safety and quality. Providence was one of 134 hospitals across the country to be recognized, and one of 4 in Illinois. So it's a tremendous testament to the work being done by the Providence team. Congratulations. Staying with Providence, we opened our observation unit in November. It's an 11-bed observation unit, and it will enhance patient healing, optimize the use of hospital resources, and represents just one of the many investments that we're making on the south side. We also announced the doula program on December 3rd. We held a press conference with County Board President Tony Preckwinkle and Commissioners Miller and Degnan to celebrate the doula program being established here at Stroger. Doulas are non-clinical support professionals trained to empower and support birthing parents at all stages of pregnancy through delivery and in the postpartum period. And we're planning on welcoming 10 doulas to the hospital in early 2025. Are they coming to the hospital? No, they're going to come as doulas to provide services. And lastly, we celebrated our EMT apprenticeship graduation, the first one. We were joined by county government leaders and representatives from Superior Ambulance and Jump Hire to celebrate the first cohort of graduates from our EMT apprenticeship program. This was on December 12th. The program was funded through the U.S. Department of Labor and supported by Senator Dick Durbin. It was a 15-week collaborative internship with paid on-the-job training and prepared the participants for EMS employment opportunities. 17 apprentices graduated from the program, and those who passed licensure will be hired by Superior. Great. And I believe that concludes the updates.
Thank you very much.
Thank you.
For those updates. And again, congratulations to all our new hires and our promotions, and actually all the individuals who have done very, very, very good work. And also, thank you to all. I'd like to recognize Cook County Commissioner Donna Miller, who's joined us today. And Commissioner Miller, we know you are one of the champions of the doula program. So thank you very much for championing that great effort. It's I think it's going to have significant impact on the lives and maternal health of a number of people in our community. So thank you. We appreciate it. The next item is public testimony. As a reminder, and Director, it's a long preamble I have to read here. As a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted on the website. Madam Secretary, do we have any speakers who registered to provide in-person or virtual oral testimony or submitted written testimony?
We didn't receive any registrations, nor did we receive any written testimony.
Thank you very much. We'll be efficient here. The minutes of the November 22nd board meeting are being presented for your approval. Are there any corrections needed to be made to the minutes? Hearing none, I'd like to entertain a motion to approve item 4A, the board meeting minutes of the November 22nd, 2024 meeting.
So moved. Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? Hearing none, all in favor?
Aye.
Aye. All opposed? Thank you. The motion carries. The ayes have it. The ayes have it. The motion carries. Sorry. Next, Director Bott, Are you there? We'll review the quality and
I'm here.
safety committee. Oh, perfect. You'll
Yeah.
review the quality and patient safety committee
Yes.
meeting.
We'll review it. Thank you, Mr. Chairman. All right, let me get it sorted out here. All right, the Quality and Patient Safety Committee met on Wednesday, December 11th at 9 a.m. The committee approved the following action items, which are included in the minutes. Approved one Stroger Hospital Department Chair reappointment and one Stroger Hospital Division Chair initial appointment. Approved Stroger and Provident Hospital medical staff appointments, reappointments and changes. The committee received the following reports, which are included in the minutes. The updates from operational excellence work groups, readmissions at Stroger Hospital, throughput at Stroger Hospital, clinical outcomes at Provident Hospital, HEDIS health registries at ACHN, clinical outcomes at Stroger Hospital, throughput at Provident Hospital, the OpEx dashboard, regulatory accreditation update, and the quarterly grievance report. The next meeting of the committee will be on Friday, January 17th at 9 a.m. There are no other questions on the minutes. They're being presented for the board's consideration at this time.
Thank you very much. I'd like to entertain a motion to approve item 4B, the minutes of the meeting of the Quality and Patient Safety Committee of December 11th, 2024, containing the following action items. Approval of one Stroger Hospital Department Chair reappointment, approval of one Stroger Hospital Division Chair initial appointment, and approval of the proposed Stroger and Provident Hospital medical staff appointments, reappointments, and changes.
So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? Hearing none. All in favor? Aye. All opposed? Thank you. The ayes have it. The motion carries. Next, Director Harrington will review the Finance Committee meeting minutes.
Thank you, Chair Taylor. The Finance Committee met on Friday, December 13th at 10 a.m. The next meeting of the committee will be held on Thursday, January 9th at 10 a.m. The committee considered the following action items, which are included in the minutes. Conditionally approved 24 contracts and procurement items. Number 1, 2, 7, and 21 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meeting, whose fiscal impacts are greater than $1 million, which are highlighted for your information. With regard to request number 14, there's a request to extend and increase the contract with Legal Aid Chicago for legal services to remedy health harming needs. Director Green requested a breakdown of demographics for each category of service provided to the CCH population under the contract, and I'm sure she will receive it. Received and filed the grant award related items. The committee also received the following reports, which are included in the minutes. MWBE report, report of one emergency purchase, report of the October 2024 financials, monthly report on agency reduction plan. During the discussion of the MWBE report, Director Robinson inquired regarding previous year's reports on participation. Mr. Jones responded that the Cook County Office of Contract Compliance provides an annual compliance report every year. He will send the most recent report for calendar year 2023 to the committee. If there are no further questions, or if there are questions, if there are no questions, the minutes are being presented for the board's approval at this time.
Thank you. I'd like to entertain a motion to approve item 4C, the December 13th Finance Committee meeting minutes, which contain the following action items. Conditional approval of the contracts and procurement items, pending review by contract compliance, and receiving and filing of the grant award related items.
So moved.
Second.
Thank you. The motion has been made and seconded. Is there any discussion on the motion? Hearing none. All in favor? Aye.
Aye.
All opposed? Thank you. The ayes have it. The motion carries. This month, we do not have any contracts being presented directly to the board for consideration, so we can move into the next action item, which is my report which is on committee assignments. A number of new committee assignments have been made. Vice Chair Lowry has been appointed to serve as the chair of the Managed Care Committee. He has also been appointed to serve as a member of the Finance Committee. Director Burnett Ziegler has been appointed to serve as a member of the Managed Care Committee. And Director Green has been appointed to serve as a member of the Finance and Human Resources Committee. Additionally, Director Kim has agreed to be appointed to serve as a member of the Audit and Compliance Committee. Thank you all for agreeing to your service. As a number of you know, the work of our board, the vast majority of our work of our board is done in committees. And so we thank each of you for the work, your dedication, and agreeing to serve. That is my report. Next, we will have the CEO report from Dr. McInnes.
Thank you, Chair Taylor. Hello again, directors. We have two items as part of the CEO report. First, nursing operations update, which we give quarterly. And second, as we're rounding out the end of the year, a strategic plan update that will cover a look back of where we've been 23-24, and then our goal setting process into 25. So, and then a bit of a high level overview of what this next year is going to look like. As I'm sure you're aware, we're rounding out the 3-year kind of term of the strategic plan. So we're going to be planning in 25 for 26, 7, and 8. So there'll be a kind of monthly stepwise process to work through all of that. So we'll cover that at the end of that update too. Okay, I think I see Dr. Peters.
Welcome, Dr. Peters.
Good morning, Directors and Chair Taylor.
morning.
I'm excited to share our quarterly nursing report, especially the end of the year report. As many of you heard that the nursing priorities started in 2019 based on zero harm initiatives, that is provide safe quality care to our patients, efficiency in the care delivery model, workforce planning and development, and as well as improve patient experience, growth, innovation, transformation, and optimization and systemization, which align with the CCH pillars. Next slide, please. So from a patient safety and clinical excellence and quality, the nursing qualities are measured based on Indian QI, which is a national database for nursing quality indicators. This is where we are benchmarked to make sure that we are performing as well as we are also improving. So, with that, I'm so excited to hear that hospital-acquired pressure injury was on our top of the list 5 years ago. Since then, we improved that by 97%, which is actually took both Soldier and Providence Hospital to be one of the top performers in the country from the lowest performers. So that's, again, this work happened with the frontline nurses really making the cultural transformation to provide excellent care every day. And remember, in this particular case, during COVID, nationally, the happy hospital-acquired pressure injury increased by 8%, but I think County Health nurses held it to their heart and continued to make the improvement. Other piece of nursing quality indicators is falls and falls with injury. As you can see, a 50% reduction. Central line and Class C central line associated infection also reduced significantly, and catheter-associated infection as well. We are also put number of actions in place to make sure that the leapfrog score specific to nursing is in place, especially medication scanning and other items. So we are also, to exceed our expectation. Areas we need to focus still on patient experience from nursing perspective, even though we improved significantly for the last 6 months. What that means by quality and the cost, right? Each hospital-acquired condition associated with the cost to the hospital through length of stay or also other costs associated. So if you take all those improvements for the last 4 years, it's more than $25 million of cost avoidance by improving the care we provide to all our patients. Next slide, please. So lots of focus on acute care, which is Soldier and Providence, because that was the area that we needed to focus. But after that, we also integrated number of activities within the ambulatory nursing, correctional health, and as well as public health. We implemented the virtual nursing care programs, and also we are working with the different service line to optimize the staffing where we can have the top of the nursing license practice. We are also working with the community colleges to really bring in MAs and students to our outpatient setup settings where we can hire them as a workforce strategy. In fact, we hired number of MAs and others through this strategy. Also, we are having the senior nursing students rotate in the ambulatory setting. Historically, nursing always rotated in the acute care hospital. We are shifting. Now we have students rotating ambulatory, correctional health, and also public health. That's really introducing those concepts to the nursing students in their early career to make the choices. Other big piece is Pathway to Excellence. You will hear more about that program the coming slides. Also, within the correctional health system, we are really focusing on safety and quality, and one of the highlights for is we are removing the personal medication at the detainee centers or the two provided by nursing because, that can create quite a bit safety concern. So with that process change alone added more than 15,000 medication deliveries now managed by nurses. But again, that's the best practice across the country. Again, our public health nurses are actively out there and really, working on the concept of public health from a preventive perspective and collaborating with the entire public health team, CCDPH. Next one. If you look at this is something, seen it, but when we also look at our nursing turnover, this is very important that we focus on nursing turnover. There are a number of activities are in place. Actually, Cook County Health nursing turnover is one of the best in the country. If you can, slide, nationally average turnover is 22.5%, where we are below 10%. If you are below 10%, that is usually the top 95th percentile performers. Next slide. So these are some of the workforce activities that we implemented in the, continue to do to maintain or to achieve our nursing turnover and engagement. We have a nursing residency program we established in 2022, where the new nursing residency program for the new nurses, with this program, we can decrease the nursing turnover within the first 2 years by 85%. We established that, and we are seeing that improvement. We also have a nursing externship program where we hire the senior nursing students. They go through a 16-week program, and that is also a strategy for hiring. And actually, we hired the 2 nurses from that program 3 months ago, and they are excited to join us. So they get to know us, we get to know them. Other programs is also nurse preceptor training. I know we have a huge nursing vacancy to fill. In order for us to really make that happen, we need to train the precept nurses, and we train more than 200 preceptors in preparation for our hiring. Journal Club, it's very important that we bring the evidence-based practice at the bedside, so we established the Journal Club for nursing last year, and a lot of, more than, hundreds of nurses participate across the system monthly now. We also have nursing grand rounds. This is where the nurses bring in their best practices at the bedside and engage them rather than only the leaders are talking. Now, nurses are releasing the best practices. We had our nursing school summit, second one. More than 30 nursing schools across the Midwest participated, and I do have a slide coming about the outcome. And also, we have nursing certifications. We are on ANCC accredited program. We have our nurse managers participating in our Illinois Organization of Nurse Executive Fellowship program to prepare them the future leaders, prepare the future leaders. Next slide, please.
May I ask a question? You are presenting some extremely impressive information. My question is, who else knows about this outside of Cook County Health? Because I think this makes for an extremely good advertisement from a variety of standpoints, from a recruiting standpoint and from a federal dollar standpoint. Because the numbers are here, but if the story isn't told, then it doesn't matter for those particular things. Because your numbers are great. This is fantastic. So that's the question.
Thank you so much. We actually started presenting outside of the Cook County about the best practices. That is something new to us for the last 2 years. More than 15 posters were presented outside of Cook County. One of them were at the Northwestern. When we presented, we got the second prize, and they said, oh, we didn't know that we were doing all this thing at Cook County. So we are doing that. Plus, I had a discussion with Alex this morning. How can we take this information not only do the advertisement, but also part of the recruitment strategy, right? So I think this is an opportunity for us to really share the stories of what we have done for the Cook County.
Very good numbers.
Great numbers, great numbers.
Next slide, please. So this is, again, the residency program, I talked about it. When we have it, now we have more than 30 nurses, new grad participated, they love it. And when we do our nursing hiring fair, people ask us, do you have the program? So we do have it. So this is great. And actually, we are bringing in, they really bringing the evidence-based practices at the bedside as nurses. So this is the highlights about the last graduation. Next slide, please. This is just want to highlight, we started our nursing school summit last year, and we had our second summit in June. Since we started the program, we increased the nursing student placement by close to 300%. That again is a strategy to bring in nursing students to our system as a future workforce strategies, and so this is huge. And we also revamped our student orientation program based on the feedback we received from more than 30 academic facilities across the Midwestern, because they always got hard to get it. We now do the survey with the students, survey with the faculty, so there's a lot of work is happening in this area to build our future workforce. Next slide, please.
Dr. Peters, before you move on, I do have a question to your point. On this slide, you highlight that we are expanding opportunities in correctional and Providence, and we also have this rotational program, right?
Yeah.
Where have you seen for the rotational program first, do they rotate through all three, Strozier, Providence, the correctional facility as well?
Yes, we actually expanded our rotation to Providence maybe 12 months ago. We also have rotation at the correction, especially the LPN program. That's where one of our biggest gaps. So we have that. So there's a few more logistics we need to work around the correctional on the nursing students rotation, which I'm hoping that by next spring we can address that and have them there.
Okay.
And public health and also ambulatory, because the healthcare is moving outside of the four walls of the health system. So we are actually ahead of bringing the students to those settings. Thank you. This is again to highlight our nursing student externship program. This is one of the best practice. And from this program, we already started hiring students to us nurses to our system. Next slide.
Dr. Peters, before you move on, relative to the S&E program, registration is already open for the program for FY25, or is that coming?
It's coming. It's coming in February for the summer program.
If you could, I think it's important that this opportunity is shared with all of my colleagues on the board. And if we have similar opportunities coming up in FY25, I'm happy to, and I volunteer to be the conduit, but I'd like to have that information so that I can supply that information to my colleagues so that they can put in their own respective schedules when this is coming so they can have outreach to their districts.
Thank you so much.
Thank you.
Love to reach out to you to get that happen because we really need to bring in, the students from our own community we serve to be the future employees. So love to share that.
Great, thank you.
Dr. Peters, the rotational program that you mentioned earlier about Providence, Strozier, and the correctional facility, how does that compare on a national basis? What other systems have such of a rotation program?
So when I shared the opportunity for us to rotate nursing students at correction, public health, as well as ambulatory, College of Nursing were so excited because we were actually probably one of the systems that leading that initiative. From a Providence perspective, that is the acute care hospital, right? That's always is the standard, but we never had it. But I think the work we are doing, the other setting is actually one of the best practice. In fact, one of the dean told me, like, they invited me to present at the American College of Nursing Association to talk about the future and the collaboration.
The reason why I asked the question, because we have quite a few nursing students in our area, but if we have something special, then there are other places that may find it advantageous to have their students rotate through here. And if they get a chance to experience what we have to offer, then we may find a way to expedite the hiring of nurses.
Yeah. We are planning also a nursing student fair. right? We're going to invite all these nursing students and have a fair too. So that's on our planning list, which I think the next time I can give more update on that, because we have to get the right students who are passionate about our mission to be part of our team. So.
And if it may not be possible, but I'm pushing to go beyond our borders. The other systems that may exist out there, whether it be in Georgia, whether it be in Ohio, wherever, because it is special here, and the others need to know it, and if they can recognize it, we may find ourselves on the surplus of nurses versus searching for nurses.
I'm with you, yep, happy to. Look at Dr.
And-
McCarty's laughing, that means
and
he's all for it.
Oh, I was gonna say, Dr. McCliss may even look at some of the, universities around here
Yeah.
to work out the housing aspect of it, to really create a program that makes it become, because I'm thoroughly convinced that I think Cook County is one of the best training facilities in the world. And I think we should highlight that to really execute on getting the proper people in here so that we don't have to have a deficit in areas if we just utilize our assets.
Yeah, couldn't agree more. And we've started locally, conversations with Malcolm X already, and looking to grow that, but I hear you about reaching beyond the Illinois borders, absolutely.
Great, good comment, thank you. Next slide, please. Again, this is something I really wanted to highlight here. Lots of work is done with engaging our frontline nurses to be part of the shared governance, right? Because we say, if you are going to make a change to your practice, they need to be part of the decision. This highlights the first time at Cook County Health, if I recall correctly, the employee engagement survey, our nurses actually exceeded the 50th percentile national benchmark. I think this is the highest ever I've seen, the report. But again, nurses are highly engaged and they are actively participating in the practice changes and things like that. So I want to highlight that too. I know Dr. McCarthy highlighted this last time. Yeah, I'm so excited. This improved significantly if you look at from the last 4 or 5 years. Great job. Next. This is one area we are still focused on our vacancy rate and filling in, and I'm still working closely with the HR, the partners here across to really improve that. So we are still holding a 37% vacancy rate, and as you see nationally it's around 10%. So a lot of work is being done to get our vacancy, to hire people, to decrease the vacancy. Next slide. So there, I just want to highlight some of the actions in motion, and next slide, please. So I know I presented to the board about the magnet, which is, our nursing excellence journey, and there are 2 types of process in place for American Academy of Nursing to accredit a hospital system based on the nursing practice. So one is magnet, and the other is called Pathway to Excellence. We had number of, our system assessment done, and the group decided to go on the journey of Pathway to Excellence certification here. The reason why Pathway to Excellence program cover acute care hospital, ambulatory, correction, and also public health. So that is the right fit for us. And so we started the journey, and there's a lot of work is happening in this process. And Pathway to Excellence program also really focused on the work environment of the clinician, the nurses, and the staff across, because we have to improve us to really engage them as well as produce the outcome we want them to, drive. So these are the 6 focus area. Shared decision making. They will be part of the shared governance structure. One of the staff nurses will co-chair the council with me when we establish it, so they have an equal, voice in it. We also have to look at the leadership, training our leaders to how to drive change within the shared governance structure. Safety is important, quality, well-being, and also professional development. Those are the 6 pillars we will be, driving to make this Pathway to Excellence accreditation at Cook County Health System across. Next one.
I have a question. I assume there's a cost for this, for them to participate?
Yes,
And who covers the cost?
The cost of this program is $2.1 million for the next 4 to 5 years. That includes the nurses to participate in the meetings and building and the training, as well as there is an application fee for this program.
And we're covering those costs.
Yes, this is part of it.
So I want to commend you for making that investment in our staff. I mean, I think that needs to be acknowledged.
Thank you.
Exactly. Thanks for using that word. This is an investment, right, in the staff and the quality of care. So thank you.
And you can see that when we improve the quality, we get the dollar back, right away. So this is highlights again, these are the level of details, but I want to, really highlight the three main steps. One, shared decision-making structure. This is where the shared governance is coming. And also, we have to look at the culture of positive practice environment. This is where the nurses need to feel like they are supported to practice. And the third one is finalize the application. So we actually have a stretch goal of at least putting one application this year by end of, September, by end of November. We'll have either ambulatory or correctional health will be ready for an application. More to come on that. Next slide. So this is the highlights on all the actions were in motion, so you can see that. So lots of activities are started and more to do from this perspective. Next slide, please. So if you look at it, this is going to be our professional governance structure. The center is patients and surrounded by all the caregivers, including the leaders and the staff. So these are the four focus areas. We'll be looking at the clinical practice, well-being, leadership, quality, evidence-based best practice, and the professional development. So this structure actually developed by our shared governance structure from the input from nurses. Next slide, please. We kick off our first shared governance structure in August, and to build everything, you need to have the structure in place. Next one, please. And also, there's a lot of focus on research and evidence-based practice. That is an important piece of nursing practice to bring the evidence-based practice. And I think I mentioned about this slide. When you ask the question, how are we taking our information outside? Our nurses are participating in many activities outside of Cook County, presenting the best work that they, we demonstrated, presented at many places. And also they are winning. They got the award for one of the best evidence-based practice at the Illinois Nursing Organizations and others. So more on this detail, where we have our nursing research and innovation director hired 12 months ago, almost 12 months ago, and she's really driving this changes. So a lot of activities here too. In fact, for nursing research, our first nursing research IRB was approved 2 weeks ago. So that's coming. So on well-being, so more to come on that. Next slide. And also we are in the process of exploring to apply for a Beacon Award, which is a special award for critical care nursing and the unit. So both Providence and the Soldiers departments are preparing for this recognition. Next slide. Nursing Innovation and Fellowship Program. I think the healthcare needs to be innovative. We all know that Cook County Health is part of the Nursing Innovation Fellowship Program led by Johnson & Johnson and Penn State, as well as the Wharton School of Nursing. They take the CNE and one other staff, and we are actually doing our pilot at Providence. More to come on that, really involving and redesigning the care delivery of nurses. So this program will end by May, so that we will have our project and everything ready to go. But really, it's a lot of learning on how to innovate healthcare on this through this program. Next slide, please.
Dr. Robinson, I think this goes to your little point, right, about broadening our geographic reach and connections across the country.
This is the program, actually, they picked only 10 hospital systems across the country, and we are one of them. So that's a lot of learning in this program, too. Soon coming, we will be hosting 2 Midwestern conference. Both are first in for Cook County. One is Correctional Health Conference, which is actually for the Midwestern. It's coming, led by Cook County Health team on all the best practices from our correctional health system. We will also host our Cook County Health Nursing Innovation and Research inaugural evidence-based practice conference soon, January. And also more innovation work will come under Dr. McKay's leadership on really bringing that innovation and change institute together. So nursing will be active participant for that too. Next slide, please. Thank you so much. Long report, but it's just, let me know if you have any questions, comments.
No, thank you. It's a good report. It's, a great way to end the year. We often have these reports and we highlight all the problems. So, and all of our challenges, which there are many, and we recognize them. But it's great to have a report that recognizes the progress that you and the staff and team have made, and we really appreciate it.
Thank you so much. Thank you.
Thank you, Bina. Thank you.
Bill?
Andrea Gibson for a strategic plan update.
Good morning.
Good morning.
Morning.
I'm Andrea Gibson, Chief Strategy Officer, and as Dr. Nakaitis previewed, what I'll be going through today are the updates from the last 2 years, our goals that we have collectively worked on for the next year, and that will, be the end of the strategic plan that we're currently in. At the same time, next year, we are going to engage in a strategic planning process with you starting in January. So I want to preview what that will look like a little bit. Starting, what I'm going to do is start with each pillar. I'll go through all 7 pillars of our strategic plan and show what we have accomplished in the past 2 years. I won't read every single word, but I'll highlight a few things and then go into the goals for each pillar. So if you can go to the next slide. So under our quality pillar, patient safety, clinical excellence, and quality pillar in 23 and 24, I'm going to restate some things that you know, but these are big accomplishments, like increasing our Stroger rating from Leapfrog to a B, achieving reaccreditation with Joint Commission, and CIRMAC achieving National Commission on Correctional Healthcare Accreditation. And also I'd like to highlight that the health plan achievement of the 4-star rating. We have some other accomplishments there. And then we'll go to the next slide. Certainly looking at some of our historical quality metrics, you can see that we have we've accomplished some improvement in these metrics, including a reduction in readmissions, reduction in left without being seen at both Provident and Stroger, increase in the palliative care consults, an increase in hand hygiene. So all of those contribute to the ultimate outcomes on our quality ratings and metrics. Looking at the next slide on outpatient, we took 2 of the metrics just to show where we've had some improvements. Cervical cancer screenings have gone up, and also those engaged in managing hypertension has also increased, and those help support better outcomes. Finally, the next slide looks at county care. So as a health plan, we have seen an improvement in our HEDIS metrics. There's only one on here that we did not see an improvement on, and that's certainly a point of focus for the coming year. So these all tie back to that first slide of achieving quality recognition for the elements of our organization.
And your question, before you move on, the one area is follow-up after ED visit for mental illness. Was that due to staffing, procedure, late start? Why do we think we didn't achieve our goal?
Well, this has been a challenging area, like everywhere, and recall this is for the health plan, so this isn't just us as a provider.
Right.
Although, we do see that metric for us as a provider, that we have an opportunity to improve there as well. I think it speaks to the general need for more investment in behavioral health resources, mental health resources, and that's just a challenge to connect people. So yeah, staffing, I would say. Would you agree? You want to?
Aaron, you want to come up? I know this is your area.
Good morning, Aaron Gleaner, Chief Administrative Officer with County Care. Yes, I would agree that staffing capacity is a key issue here, particularly on the provider side. This measure specifically requires a follow-up within 7 days, and one of the biggest challenges, especially in Medicaid, is getting that access for members and that quick of a turnaround time. So the process of getting the notice, that an ED visit has happened, getting a care coordinator engaged, and getting an appointment with a doctor, or in some cases, a follow-up assessment can be done within that time frame is the biggest challenge here. So we've tried to both expand capacity as well as we have focused on adding telehealth, behavioral health providers specifically to try to be able to create more capacity to improve on this measure. Thank you.
Well, relative to this category, follow-up after ED visit for mental illness, what's the data showing relative to our facilities compared to last year? Do we have that?
Yeah, I don't have that offhand
Yeah.
either, but we could.
Let me just suggest, I think that's important for us to have, especially with us now preparing for the Bronzeville Health Center. I think that's a great opportunity for the community. I expect that we're going to provide just amazing care, and I want us to be able to spread that word as we gather that data. Okay, thank you.
Yeah, and in order to understand this problem, we probably need more data in terms of how large this patient population is. These are people that have a mental illness. They may also, many of them may be unhoused, and that may be a real problem trying to follow up people that don't have stable housing. But the more information and data we have about this population, how large it is, and some of their needs, there may be some things we can do that are very creative moving forward. That's what I would suggest.
Aaron, and Andrew, I recognize that this is on county care, not our overall
Right.
population. So we know we're mixing things together, so we recognize that. But I just want to acknowledge that. 'Cause
Well, yeah, we are a
Clinical.
component of this as a provider. This is certainly one of the measures that
right.
county care measures us as a provider
Okay.
for. So, and it's something we've developed some internal strategies on too.
About us as a provider. Yeah,
And
I mean,
Good.
And I would say, cutting across all of that is the work that Dr. Nutter and his team are doing with Office of Behavioral Health and, working countywide, right, with all providers to try to improve how we deliver behavioral health care.
the director, I just recognize Director Bott's not here. Director Kemp, not to you, but let's go to Director Bott. You had a question, your hand was raised? We'll come back to him. Director Kemp.
Yeah, so the question is about the follow-up after hospitalization. You know, in fact, that number is lower than ED visit. So, you know, I'm sort of surprised that hospitalization is like sort of easier to follow up patient after hospitalization because, you know, they're more stable, stayed with the system longer. So even though you have the green, you know, color there, it's 23%, right? So what do you think that hospital and ED visit, you know, follow up there, the gap?
Yeah, I think I would say overall for both of these measures, like the follow-up after hospitalization for mental illness, while it's showing green here, is certainly still an area that we need to get better at. And not even specifically just county care. I think overall in the Medicaid space, when you look across all the health plans, kind of the top performing health plans on the BH measures are only 5 to 10% above these numbers here. So there is an overall good performance still isn't really that good. And so I think there's a need across the entire space to see improvement here. And a lot of that ties back to, again, some of the capacity concerns, a lot of the work that Dr. Nutter and his team has been shining a light on across the entire market. I think on the hospitalizations, we have, I think we feel good about some of our strategies there that we're putting in place. Some of those just take time to flow through, but we're working on things like getting our care coordination teams on site at these hospitals where they can immediately connect with those individuals as part of the discharge process to connect them to that follow-up care more immediately. And the volume is lower there than the ED visits. Obviously, there's a much larger number of people that have ED visits versus hospitalization. So I think we see a lot of opportunity, especially in the follow-up after hospitalization, to improve those numbers.
Yeah, another thing, and it's really a point of information, and some people may already know this. A lot of emergency room visits are unnecessary because people are not in, they don't see a doctor regularly. When something happens, they show up in the emergency room to find out what's happening. So there's a difference in terms of what emergency room does. The emergency room, particularly for us, since we're trauma center, is for people to have a life-threatening illness. You know, about to die. They're brought here because they're suffering a heart attack. People come in with colds, sprained ankles, and so that's a whole nother discussion, but I just want to provide context. A lot of emergency department visits are unnecessary from a clinical standpoint.
Thank you.
So the question I have is on the follow-up after the ED visits. When we look at that, do you have an understanding of where are those visits occurring in comparison to the different locations?
Yeah, we have that broken down by provider, and our approach has been starting to focus on where that highest volume is first to try to build out again, either on-site resources or workflow specific to
So we're looking at embedding in those areas.
Yep.
Okay. And then secondly would be, after doing that, the whole engagement, because hence that's the key. Do you have a thought or strategy toward engagement?
Yeah, I think there's a couple aspects to that. One is, I think particularly in the behavioral health population, being able to establish that trust and engagement initially is one of the most important things, and that's why, again, we've started shifting to try to be more on-site with our care coordination teams at the facilities. That way, as part of the discharge process, there can be that connection and handoff, and so, you know, it's not that they're just getting a call 2 days later from, you know, someone that they don't know, a number they don't know, or someone's going out to their home to try to engage with them. So there's much more opportunity to establish that initial trust and connection as part of that initial visit if we're on site. So that's kind of opportunity number one. But then once that's established, I mean, the other part of this is lowering the denominator in these measures, right?
That was
Like
my second question.
eliminating
Yeah.
the number of ED visits that are happening themselves, for example. And that gets to maybe more of your question about what's then the longer term engagement strategy once we've made that initial connection. And we've certainly got workflows that we've been developing around that to try to ensure that once we make that connection, we then build that engagement around them, help them with other needs they may have. A lot of those ED visits may be, you know, related to things like housing insecurity or other issues that are happening. So all of that is kind of built into the framework of what we're trying to build out.
Okay. Thank you.
One last, I love that you're incorporating virtual visits into this process. I also heard that you were mentioning having on-site services. Is the thought, am I following you, is the thought that the on-site person that would be able to connect with the patient at that time would also be able to set up that virtual visit, and you're going to build open access capacity, incorporating, recruiting more providers to do so, build the capacity to put those patients in those slots before the patient leaves the ED and before the patient leaves the hospital?
Yes, exactly. That's the goal.
Okay, I think that's great.
And that's been a sequence, right, of things that we've been building a workflow for, and then finding the next problem in the sequence, and then trying to build next. So when we developed engagement, we moved to the next issue of we weren't able to get appointments with providers within 7 days, which is when we went out and found telehealth providers that were willing to give us immediate, you know, basically contractual guarantees that they would provide that level of access that we could schedule appointments.
Director Harrington, and I'm going to.
Yeah, when I looked at the question or this more carefully, these are follow-up after ED visit for mental health illness. Somebody came in because they were experiencing some kind of mental health illness. What we don't know is how many people we're talking about. The percentage, and we're talking about the drop in the percentage, but how many people, we're not talking about 1,000 people. We may be talking about 500, we could be talking about 40 people, we could be talking about 50 people. But some of this, we don't have enough context to make
You're right.
an
Yeah.
informed decision.
And then again, this is part of the strategic overview. This is not part of the managed care review. So what we'll do is, just to be clear, directors, and I recognize I started it. So, Aaron, I think that we have a couple of things, right, of questions you filed with the company directors as you do the managed care update. Yes, absolutely. You can walk everyone through it. Thank you very much. And Commissioner Lowry, I'm sure will be overseeing it. So we look forward to hearing the updates through the course. Thank you. Thanks.
All right. Thank you. So we can go to the next slide. So under our quality pillar, we have identified 3 goals for 2025, and that's to continue to push to improve our quality ratings and the supporting metrics, and then also, as Dina outlined, build on the foundation that has already been established on the pathways to excellence and pushing that forward. Next slide. Under the health equity pillar, I'll highlight a couple of the accomplishments from 23 and 24. Certainly, serving the health needs of thousands of new arrivals was important to us and to those patients, but also I'll highlight the amount of investment that we have made in behavioral health through the Stronger Together grants, through the Office of Behavioral Health, having the Behavioral Health Summit, also awarding a number of grants through public health for behavioral health, launching a number of public health campaigns, Boost Up, Here to Hear You, Let's Get Checked, Every Mother, Every Child. And then for the health plan, really leaning into the food insecurity issue. And, the health plan was recognized as best in class NACO award for the food care program that was established. So those, among other achievements these past 2 years, have pushed this pillar forward. Going to the next slide.
And just to clarify, for the behavioral health investment or awards, we show 44 million, right, for Stronger Together.
Yes.
We show 17 million for building health community, so a total of 61 million in awards.
In grants,
In grants,
the amount of investment for behavioral health is actually greater than that. If you recall, this is principally funded by ARPA.
Right.
And that also funded social workers in our ACHN clinics, work on opioid use disorder, among other things. So actually, the total investment is north of 100 million.
Thank you.
And quickly, is the behavioral health community needs assessment publicly available somewhere?
Dr. Nutter?
Dr. Nutter, is it available?
The community needs assessment was, Tom Nutter, Chief Behavioral Health Officer for Cook County Health. The community needs assessment was completed a couple of months ago, but had not been presented yet internally until yesterday. So we should be able to release that later on today.
Very timely.
So
All right.
be prepared for the next meeting. Just telling you.
To be continued. So looking ahead to 2025 in the equity pillar, we are working to attain equity certification accreditation, both as a provider and a health plan. We also want to continue improving access to care and, expanding telehealth further, for example. And the third goal is to continue to enhance our infrastructure for social risk factors. I think you all are aware of various investments to address housing insecurity, food insecurity, and things like that, and certainly the ARPA funds support a lot of those programs. And so we're going to continue to establish a bigger footprint in those areas. Finally, improving the impact on targeted populations through research. I think this ties back to the presentation from Mark Branca a few meetings ago. Next slide.
Quick question.
Yes.
what do you need to do to get this, equity certification?
Well, I think there's two, right? There's the equity certification through the Joint Commission as a provider, and there's an application process that Quality and Equity Inclusion are engaged in right now. I don't have the details on what is included in that, if that's what you're asking, but I think this quarter we should see that application submitted to the Joint Commission. Do you want to expound, or?
No, that's
that,
exactly
okay.
right, yeah.
All right. So the next slide, looking at workforce, talent, and teams, looking back at 23 and 24, certainly establishing a Hiring Central intranet site has been helpful for internal processes. We also had a lot of job fairs, 77 job fairs, and we hired over 300 people through those job fairs. Also, I'll highlight the Providence Scholarship Fund Awards. We've, shown here both for 2023 and 2024, we saw an increased number this past year as an important initiative to support pipeline work. Also, the last thing I want to highlight on here is the improvement in the employee engagement percentile. We were at the 7th percentile, now at the 21st, so that's certainly positive for us. Looking at the next slide for workforce, the first goal for next year is to increase talent acquisition, and what is embedded in that goal is reducing vacancies by 20% and reducing agency by 20%. Also completing the workforce transition from Hectone to CCH and establishing additional pipeline programs. The other goals under this pillar are about improving employee efficiency, increasing employee engagement and retention further, and enhancing performance management. Next slide. Under experience, we have some accomplishments over the past 2 years to highlight. I'll point out that there's been some focus on the discharge process and making that more patient-friendly, and that's had the impact of both providing additional information to patients and also helping address some of our length of stay issues. We've implemented some new wayfinding signage to help orient people in our facilities. And I know that many of you have seen a lot of the murals that are at CERMAC and our health centers. Also want to highlight that the health plan achieved 4 stars in the CAHPS rating of the health plan surveys from their members. Next slide. So as far as our goals, there are 4. We would like to continue to improve our patient experience response rate and the metrics, improve the member experience scores for the health plan. At CERMAC, we would like to expand our gap analysis there to really improve our discharge planning process for detainees upon release, so that we are connecting them with services that will have more of an impact. Also, we're planning to launch a culture of safety survey, and we have a response rate goal of 40%. Looking at the next pillar, next slide. So some of the things that we worked on in the past 2 years including improving the year-end net position, improving, not having an audit with no material weaknesses or significant deficiencies, reducing our accounts receivable days fairly significantly, and of course, doing a lot of work around the revenue cycle turnaround plan. In addition, the health plan worked on a number of savings initiatives, including establishing a pharmacy contract that saved $25 million for the health plan. Next slide. So the overall objective in fiscal resilience is to achieve a net positive margin this coming year. There are three kind of subcategories. The first is ensuring our expenditures stay within budget, and we have a number of strategies around that. Secondly, to meet or exceed revenue projections, and we have a number of strategies there, a lot of which are tied to the revenue cycle turnaround plan. And then finally, ensuring sustainability. So there are some aspects of the work in 2025 that are important for going forward. Sustainability, including the waiver implementation, especially for CERMAC, looking to being able to collect revenue to get reimbursement for health care that we provide at the jail, as well as applying to the state MCO process for the health plan to make sure we stay in the position, that we're awarded a contract and continue to have the health plan. And finally, I'll point out, we really need, in 2025, to finalize an ARPA sustainability plan. Those investments through ARPA really jump-started a lot of initiatives, and now we have to think about how we sustain some of that work.
Question. I was waiting for the ARPA. In previous meetings, we inquired about I think it's the assignment of the ARPA funds. I think we last talked about it in September. There's there's a deadline this month. Where are we? I haven't received any information on that. That's the obligation. Yep.
Yeah, obligation. So we have over, we have $174 million in ARPA funds. We're working down the last $3 million of obligation. We're confident we're going to make it. Things are in DocuSign, contracts are being executed. There might be a few small things that we'll have to repurpose the funding to something else, but overall, we are meeting the obligation deadline.
Okay, it would be nice at the next meeting if you could show us that and how it occurred, if we could see that timeline.
Yeah.
Because that was a big concern of ours, and I'm just finding out now.
Yeah, the finance, I think we had a big finance committee, we'll make sure that we do that.
Let me just add, Doctor, we were apprised of the plan literally this week. So what we can do, Tanya Anthony provided that to all the commissioners. So we now do have the plan, but it was very proximate. We just found out as well.
Yeah, we're dealing with shifting information from the federal government that has made there have been some last minute changes in how we approach the obligation, but we're on the right path to obligate these funds.
Good. Director Harrington?
I think you answered my question. They need to be encumbered but not spent.
Correct. We've spent about $52 million of the 174, and so the next thing that we'll have to be vigilant on in 2025 is spending. So getting, 2025 and 2026, we need to focus on spending those dollars now that we have contracts in place, subrecipient agreements in place, et cetera.
What's the deadline to spend down?
End of 2026. All right, next slide. Under optimization, there are a number of initiatives that we worked on in 2023 and 2024 to improve processes, both clinical processes and administrative processes. Certainly, it's no small feat to go live with some new systems for policies, contract management, and inventory management. And I'll also highlight the investment in capital equipment and capital improvements, especially for capital equipment. I recall back in 2011, 12, 13, 14, we were not even spending $10 million a year on capital equipment. And so this is much more in line with depreciation. And so that's pretty significant increase in expenditure. And certainly that helps with the care that we provide and having equipment that's reliable. Also, under the health plan, the provider directory was launched, and as we've mentioned, some additional telehealth-only contracts, and that improves efficiency. Also, public health implemented telehealth visits for the CCDPH nurses as well, and that helps them reach additional community members. Next slide.
So there is a plan for the capital improvement so that this becomes a part of the way in which the organization is being run?
Yes.
Okay.
Looking at 2025 goal under this pillar, we have two general categories of goals: improving administrative processes and improvements in clinical processes. So there's a variety of areas of opportunity, and those will be, you can read through them. But we have a lot of opportunity here, even though we've already put so many improvements in place. Next slide. Under the growth pillar, this is the last pillar, we, in the past 2 years, have implemented a new referral platform for external referrals, and just in a little over a year, we've received 21,000 referrals from other entities for various services. And we've been focusing a lot on Provident and expanding various services there, and you can see in the past 2 years, we've expanded general surgery, pain, rehab services, video, fluoroscopy, swallow studies, and permanent catheter procedures, among others, to Providence. For the health plan, growth, there was increase in the market share to over 34%, as you have seen in the metrics. And public health produced a gap analysis for their workforce in terms of where CCDPH is today and where we should be as an organization with a public health department. And so that's providing direction for going forward. For 2025, the 4 goals under the growth pillar are to grow volumes, diversify our, next slide, sorry. Diversify our portfolio of products that, we would come back to the board with some recommendations on, both under health plan and as a provider. Finish some of our major capital construction, and we're close both on the CTSC at Provident and the Bronzeville Health Center, as well as another initiative for CCDPH will be to build out the warehouse space and design their centralized future office space. And finally, there's a goal to expand and promote a public health program outreach to the community.
May I ask a question about public health?
Sure.
Public health goes out into the community, correct?
Yes, in suburban Cook County.
Okay. So they're encountering people who have health care, who have insurance, and those who do not, correct?
Yes.
Are they capable within the rules that we have to operate within to be able to have someone from county care for those who do not have insurance? Because certainly they're encountering those people.
Dr. Hasbrook.
I don't know the answer.
I didn't get off today. So we have a number of cadre of staff that go out, from the nurses to our environmental health specialists to our community health workers that do something called neighborhood or community canvassing. That would probably be the easiest vehicle to give them information to sign up. So we do palm cards with QR codes, door hangers and other things. So there's a lot of face-to-face contact that happens, not to mention what happens when we do community fairs and other things at districts and things like that. So we have the hands out there where we can do the referral pieces. And then we do a number of collaborations with folks. ACHN, for instance, we're doing Saturday clinics, immunization clinics. So we try to make sure we have the materials in hand, so whenever we're interfacing with our residents in suburban Cook,
we're giving them information to get them referred. We don't sign them up, but we can give them the information. Obviously, when they come in for a free clinic, they have that information. Sometimes they have the opportunity to be counseled or to be directed or referred. Again, putting a palm card in their hand, and directing them to places where they can actually sign up.
The reason why I asked the question is because you're in the prime seat to be able to help our revenue generating engine for this organization, which is County Care. And these people are not insured. So if we're able to do more than just put the palm card in their hand, because now if we place the palm card in their hand, we're asking them to do something. That's not the way the game works, as we all know. So if we can coordinate with the managed plan to actually have a hotline that you could actually deliver those people there, we may see a major turnaround in being able to get more people, reduce the need for unnecessary care in the ED, things of that nature, because one of the biggest issues within the health system, everything's so siloed. And you're in a very good position to help bridge the connection between all of those different silos to get people into care, to increase access and to reduce those gaps. And again, I don't have the plan, but I'm sure we have some extremely qualified folks who can come up with great ideas on how we could coordinate it and get all of those, because you're saying hundreds, if not thousands of people every week, and to find out those who are missing and get them in care, and then actually advance their health as well as advance the mission of the organization.
Yeah, I think making it more seamless is a great idea, and like, we have the right people in the room, to your point, right? So,
Okay.
thank you.
Absolutely.
Yeah.
Thank you.
Thank you, Bob.
All right, next slide, please. So that concludes the look back at 23 and 24, as well as what our goals are going forward for 2025. I wanted to preview that we have a draft schedule mapped out on how to approach the strategic planning process this coming year. So we'll start in January, and you can see that there are a number of checkpoints. Pretty much at every board meeting, we'll have some kind of presentation that ties back to informing the strategic plan. And this would culminate in a vote in the summer of the board of directors, at which time it would be then referred to the county board later, and the vote there would be expected in October. And so that will position us to have a strategic plan in place December 1st of 2025.
Thank you. Thank you very much.
Sure. Director Harrington?
Yeah, it's just an observation. I made this observation in a prior meeting, that there's a significant drop-off in patients between the age of 18 to 24. And I think that's a real opportunity moving forward to somehow address the problem that Dr. Robinson's talking about. You know, we see a lot of people during the younger years because they're required to get physicals, but most of the health care is provided to older people like me, to be perfect, and that's where most of our healthcare dollars are spent. And we could make some investment in that 18 to 24-year-old group to get them into care, get them into some consistent care. That may pay off benefits not only for that moment, but into the future. They might be less likely to develop some of these chronic conditions that we're seeing and we're treating down the line.
Yeah, I couldn't agree more. I think that kind of falls under that umbrella of population health, and as a system, we're uniquely situated because of, right, public health, a payer, and a provider. We've got kind of that whole Venn diagram of, you know, being able to meet the community in various ways. So, yeah, totally agree.
All right.
Andrea, thank you.
All right,
It's going to be we look forward to this next year in the planning process for our new strategy and our new pillars.
Thank you, Andrea, and thank you, directors, for the engagement and the great discussion. Chair Taylor, that concludes the report.
Thank you. Thank you very much. The next items are informational reports, but before I move to informational reports, directors, are there any questions or any observations before we move in? Because I know there are a lot. I don't want to gloss over any comments you wanted to make or anything like that. Any observations? All right, so we'll go. The first we'll start with a review of the Human Resources Committee meeting metrics, followed by a review of the Managed Care Committee. Thank you.
Good morning, everybody, and happy Friday.
Happy Friday.
Carrie Premick-Book, Associate Chief Human Resource Officer. All right, so this slide, which you've all seen before, is, and this is our end of year report though, so almost all of our data is through November 30th for all of the slides here. We ended the year with a little over 1,750 vacancies that were in the system that were not related to grant funding and some other special purpose funding positions. Almost 1,300 of which were in HR, which is around the 72-74% of those vacancies are actively being worked in HR, and over 50% of those are at those interviewing and selection process stages, moving us towards getting those offers out. We ended the fiscal year with 1,142 positions filled for the fiscal year total. Next slide. That 1,142 positions filled, we had a 64% offer rate, or acceptance rate, offer acceptance rate throughout the year. And of those positions filled, almost 800 of them were with external hires, which contributes to the net new number, which I'll show on another slide. And we ended the fiscal year with 119 days as our time to fill, which is definitely an increase over 2023 and even the previous years during COVID and the pandemic. However, we had a few issues that contributed that early on in the year, and then the biggest of which was some salary alignment for many of our areas in the organization where we do have that high agency usage, which I'll touch on also at the end of my report. And we have since corrected a good number of those, and we've been able to start getting those offer acceptances much faster, and so we anticipate that time to fill will be coming down in fiscal year 25. Next slide. So our current state, as I indicated, of 791 external individuals brought into the organization to fill our vacancies. And our separations, we had 463, which gives us a total net new hire number of 328, which is above our net new for fiscal year 23. And that is, although our hiring number of external hires was a little lower than last year's, because of our increased employee retention, that is why our net new is definitely higher for this year, because we were able to retain a lot of our current staff, and that progress that we've made through employee engagement and employee retention has been paying off for us. As you can see, those resignations, that middle bar graph on the far right shows that we are continuing that pace of significant decrease year over year on those resignations. Next slide. So at year end, regarding our hiring fairs for fiscal year 24, we held 22 hiring fairs and made 228 offers. We had 169 of those accepted, so we have a 74% acceptance rate for our hiring fairs, which we believe is incredibly successful, and we continue to plan out for 2025 on how to even improve that. Additionally, especially now that many of our hiring fairs are dedicated to those hard-to-fill positions, which are not just hard to fill for CCH, but also for the entire industry, including some of our specialty nursing positions, some of our SEIU positions, such as sterile processing, and we've even held hiring fairs for our police force, but those have been very successful for us, which has included a decrease in those positions, vacancies. Next slide. Nursing hiring velocity. So we extended 771 offers to nursing positions throughout the fiscal year of 2024. 422 of those offers were accepted. Our net new for the total year of 24 for nursing positions was 123, which is a significant increase when we compare it to 2020. For 2023, it was a positive 43 versus our 123. Sorry, that was a lot of 23s. I got a little confused there. However, it showed a marked progress in our nursing recruitment and retention, especially as our retention of nurses also increased significantly over the past year due to a lot of programming, both through our orientation and onboarding stages, as well as at the nursing level for their programming and continued education. And that concludes my, report, although I did want to give, a brief update verbally. We'll be presenting, metrics, in the next board meeting in January about how we've been doing with the agency, reduction program that we embarked upon. And over the last 2 weeks, as we are implementing some settlement agreements that our labor team was able to get in place related to our agency usage with our union positions, that over the last 2 weeks, especially for our largest using departments where we've had the biggest gap, we are filling those previously filled by agency positions with employees by 28% over the last 2 weeks. So we've made a very big dent over the last 2 weeks, and we have a lot of continued efforts planned over the next several weeks and months to continue that progress. So next month we'll have very detailed numbers and progress report for you, but I wanted to let you know how the progress was in the current.
Thank you for the positive.
If I could just add, Carrie, I think it's been a great job the way we're attacking it. And I was provided some information showing the decline on Reliance. Shared it during our meeting. It was well received. But let's keep up the good work. But I want to acknowledge it's been great work in a short amount of time. Thank you.
Thank you.
Again, ended on a positive update. Let's keep the trend going.
Thank you.
Aaron, you're up next.
Morning again. To start off with our county care metrics, first up is membership. We're at 419,000 members as of December 5th. We've continued to see small but very positive growth over the past few months after we've gone through this wave of redetermination. So we're continuing to see between 500 and 1,000 additional members coming in month over month. Now for the past 4 months. The next slide shows where we're at on the overall managed Medicaid market. You can see county care is still the largest by market share at 34.2%. The rest of the market has stayed fairly stable. As we've noted previously, we've seen our market share progressively tick up. We were at about 33%, 18 months ago or so. And while that's a relatively small percentage, it's on a total base of 1.2 million Medicaid members in the market, so it's a fairly significant increase.
Can I ask you a question? This is a wild question.
Well, get ready.
If you had to guess for Meridian, what percentage do you think we could get? It's just totally off the cuff. I know it's snatching completely out of thin air. I'm just asking.
And for context, I'm assuming your question relates to the fact that Meridian recently announced the termination of Northwestern from their network.
Absolutely.
Yeah, so, and for background, county care is one of now 2 MCOs that are still contracted with Northwestern in the market. We, from our understanding, that impacts around 10,000 members. So that's sort of the total potential scope of some of that opportunity. I think a large part of the effort right now is to ensure that all those individuals have awareness of that fact and that they have options where their treatment's not going to be disrupted with their Northwestern care provider. So we have taken some actions mainly on that side. So we're doing things like trying to waive authorizations for those that are coming over from Meridian to county care. Again, just trying to ensure that there's no treatment disruptions and we have a nice care pathway for them coming in. So in terms of, how many of those members will potentially pick up, it's hard to predict exactly. Not all of those individuals are unfortunately probably going to know until they later try and get care. I would say 20 to 30% is probably a reasonable estimate of that. The next slide shows the overall county care market, or the overall Medicaid market in Cook County. The right-hand side is the trend and total number of individuals on Medicaid in Cook County. So you can see that the market overall has been shrinking over time from redetermination. Our county care membership is on the left, so you can see that we have been following a lot of that same trend of decline in membership due to the redetermination process, and then we did have this big increase as we brought on the healthy benefit for immigrant adult population earlier this year. This data is only going through towards the end of the last quarter because that's data that's published by the state and what's available. But as we get past that end point there, we've seen the membership flatten out within the county care plan. This slide is now rolling over to our new budget. So red bars here are the budget for, this should be now fiscal year 2025. We'll get that corrected. But you can see we're in a good position here. We started out higher than the projections that we were making last June when we were establishing the budget for 2025. So I think we're, again, in a strong position to perform well here as we head into next year. This slide shows performance on redeterminations. It's a bit small, but I'll call your attention to the blue line at the top. That's the overall percentage of individuals that are going through redetermination and successfully completing that process. So we've seen that jump from the low 80s when we were in the large wave of redeterminations to now up towards 90% as we've seen some of the volumes drop off, and we're able to focus a lot of our efforts on a smaller number of individuals going through that process each month.
But even at the peak, we were at, if I'm correct, in that 88.5 once you figured out the process. Is that right there?
Yeah, I think our top performance month was at 91%. The next month, or the next slide, shows our overall operations measures. No major call-outs here. I think the one thing I'd flag is if you look at September of 24 for % of calls answered within 30 seconds, our kind of target is always to be above 80%. We were at 73% that month, so that triggered some right sizing of staffing within our call center, and we've now corrected some of that going forward. That's particularly important as we're heading into that open enrollment season where a large number of our members have the option to go through and pick their health plan again for next year. And then this slide shows our utilization per 1,000 in terms of inpatient utilization. We've been expecting this kind of reversal of a trend that we've been seeing where year over year we have been seeing declines in inpatient utilization as our membership grew. As we went through the redetermination process, we were expecting some of the healthier individuals to be the least likely to redetermine, and that we were going to be left with a higher acuity population in the plan. That dynamic has played out, and so we are seeing some increase year over year now on the utilization data. So you can see the blue bars here are starting to exceed the prior period of the red bars. Again, that is expected, and there's also revenue and rate dynamics that play into that, where we'll receive higher reimbursement for those individuals over time. So that should offset some of the additional expenses we'll have from that acuity change.
Does that trend continue as a result of, if they're healthier, they just do not do the redetermination, or are they no longer eligible?
I think it's a combination of a couple of things there. I think, the healthier population, also just the age dynamics of them tend to be, they're often more active in the workforce, so they're more likely to shift between Medicaid to exchange and some other products. And then, I think there's also a dynamic of young, healthy individuals that may just not be as focused on renewing their coverage, where someone who's got a chronic illness is going to prioritize that. The next slide shows where we're at on claims payments. This is a bit small, so apologies for that. But generally, I think what we've seen, and we see this each year, as we head into the end of the fiscal year, there's a process where we roll over the budget with the county, and we have to, put through new invoices and purchase orders, et cetera. So we've seen a jump up in that 30 to 60-day category. As of this week, we've had large payments flushing out to providers, and so we expect to be kind of knocking out that 30 to 60-day aging here over the next couple weeks and be back into a normal processing timeline for claims as we head forward into the year. And with that, that concludes my presentation.
We have some questions, Director Harrington.
It's not a question. I just want to reframe the discussion around the managed Medicaid market. And since I've been on this board, we've been the leader consistently, and that has not changed. And so I would like to frame it as we're not competing with the other groups. They're chasing us.
We appreciate that. We appreciate that. Thank you very much, Aaron.
Thank you.
Before we're going to closed session, I'd like to recognize Vice Chair Lowry.
Thank you, Chair. With leave of the chair, I would like again to acknowledge my dear friend and fellow Commissioner, Commissioner Donna Miller, and ask Commissioner Miller if she would please share some comments with all of us here.
Thank you so much. It's great to be here with all of you, and I just want to say lots of great things happening today, so congratulations. I just wanted to express my gratitude to this board for the doula program and all the work that you're doing to enhance maternal health care at Cook County, and it's definitely going to be a model, I think, for others to follow. So thank you for your support. Thank you for making it happen, and everyone who is part of the health system is doing such a magnificent job in really changing lives here in Cook County. So I just wanted to say thank you.
Thank you.
Thank you. Here, here.
Thank you.
Thank you.
There you go. Voice from the ether. The board will now be going into closed session. Action is not expected to be taken in open session after the closed session, after discussion in the closed session. Therefore, I'd like to entertain a motion to go into a closed meeting pursuant to the following exceptions to the Open Meetings Act 5 ILCS 120-2, C 1, 2, 11, 12, and 17. A roll call vote is needed on this motion.
So moved.
Second.
Thank you. Madam Secretary, please, the motion has been made and seconded. Madam Secretary, please take a roll call vote on the motion.
Roll call vote on the motion to go into closed session. Aye or nay? Director Bott?
Aye.
Thank you. Director Burnett Ziegler? Aye. Director Garza?
Aye.
Director Green?
Aye.
Director Harrington?
Aye.
Director Kim? Vice Chair Lowry?
Aye.
Director Ryder is absent. Director Robinson?
Aye.
Director Sorrell is absent. Director Webster Cross? Aye. And Chair Taylor?
Aye.
You have 10 yeas, 2 absent.
Thank you. The ayes have it. The motion carries. We'll now go into closed session. Just a few minutes. Thank you all. Thank you. Appreciate all your work. For all the help.